I'm Tina Drago, AM 720, KDWN, Healthy Las Vegas. This show today is going to talk about the resources that Las Vegas has for people in the healthcare field, primarily non-medical stress markers, things that people need in order to feel better, but not necessarily a doctor is involved. I want to first talk about First Person Careline. Careline is a network resource that provides lots of tools to our patients that are not directly related to health. Gina Fernandez is here. She's the executive of First Person Careline. And can you tell us about some of the resources you have?
Well, hello. Thank you for having me. We do resources for everything from non-skilled to skilled. We can resource for PCA services, someone who needs help with bathing, dressing, grooming. We help find specialty doctors, dentists, eye care, DME equipment. You name it, we can pretty much resource it and find it.
What does First Person Careline provide?
We are actually a medical transitional care resource center, so we can provide...
Where are you transitioning these patients from? Hospitals, rehabilitation facilities?
We deal with hospitals, we deal with PCA companies, home health, people just calling in, they've just moved here, they don't know anybody, they need resources for primary care, neurology, you name it, we resource it.
Do people have to be referred to First Person Careline from a doctor's office?
No. Anyone can be a client at First Person Careline. You don't have to have insurance. We help people get on insurance. We try to get them on a qualified health plan, Medicaid, Medicare, depending on what you qualify for. We help you with that. And then we find doctors and facilities that take your insurance to keep minimal out-of-pocket.
So all they have to do is call 702-551-3005 24/7. And if somebody's not available live, the answering service will take down their information and you'll get back to them as soon as possible?
Correct.
Excellent. We also have here today Myra Durazo.
Yes.
And Myra's with Absolute Personal Home Care and A Better Way. Now, Myra, what do your companies do?
Hi, Tina. Thank you for having me here, too. What we do is we provide personal care to the elderly and disabled. We help with bathing, dressing, grooming, housekeeping, meal preparation, laundry, transportation if needed.
And does a person need to have insurance in order to qualify for your programs?
They don't need to. There's a lot of programs out there where they can help pay for the services. Medicaid covers the services. There's grants out there, and there's also private pay.
And so somebody just needs to contact you directly, or can they go through Careline and Careline forwards these patients to you?
Correct. They can contact me directly, or they can call Careline, and then they will contact us.
And if they wanted to talk to you directly, what number would they call?
702-646-2722.
Excellent. So give me an idea of the average type of person or the typical person that would request PCA services from your organization.
We have a lot of cases where we deal with the elderly. Maybe their family or relatives live in another state or far from them, so they're not able to see in what conditions they are living or what help they need. So we provide a caregiver to go in there, help them with their daily activities, maybe helping them with their medication reminders, making sure that they're eating, bathing, dressing, and just keeping an eye on them, making sure that they're comfortable there as well.
This sounds like a great resource for snowboards or for people who retire here and one of the spouses gets ill and the other one needs assistance. Do you find that you see a lot of people from maybe the retirement communities, Sun City, Anthem, Siena, reaching out for your PCA services?
Oh, yes, definitely. We can provide help to them, and if they're comfortable with the caregivers, they refer to other people that are living in that area. And so we do the personal introductions, and we go out there, give them an evaluation, and see exactly what they need and help them that way.
Are your caregivers family members? Are they strangers? Are they bonded? Do they have special resources that the average person knocking on their door wouldn't have?
We have a lot of caregivers that take care of their relatives. All of our employees, including our office staff, go through training. They do fingerprint background checks. They do TB test. We check their references. So we do have them all go through training to make sure that they know what they're supposed to be doing. We're licensed, bonded, and insured.
Does your training also include like CPR?
Yes, CPR, first aid. They also have to do a physical to make sure that they're physically able to work with the elderly and the disabled.
Wonderful. What about people who have dietary restrictions? Does your staff, do your PCAs, do they get education in how to cook for somebody with diabetes or that's taking a blood thinning medicine?
Yes. Not only do they have to do the basic training when they initially start employment with us, but annually they have to continue with their education.
Wonderful. We also have here in the studio Donaldo Amador from Amador Medical. How are you today, Donaldo?
I'm doing fabulous this morning. Thank you for having me, Tina.
Well, I understand Amador Medical is a company that's been around only for a few years, but they're coming on strong in the Las Vegas community.
That is correct. We did open in 2011, so we've been in service for the last 4 years, and it's an ever-growing market, and we're noticing that there's a lot of need for the supplies and equipment that we offer.
What's your specialty?
So we specialize in incontinence supplies, briefs, pull-ups, underpads, chucks, anything for the home. Also home bathroom safety equipment. We do shower chairs, grab bars, transfer benches. And we want to make sure that clients are safe in the home. We also can carry walkers, wheelchairs, canes, and all kinds of medical equipment.
So my uncle had a need to have his bathroom redone, and we knew we could buy the equipment, but we had really hard time finding someone to install it. Do you have people that will do that?
We do work with several local handymen that we have resources to that will go out to your home and install the equipment for you. Yes.
So you can offer a turnkey service.
Yes, we can. Yes,
Excellent.
A one-stop shop is what we consider ourselves.
Now, people who have incontinence supplies, I see them everywhere in town. Why would they buy from you versus going to Albertsons or?
Well, that's a great question, Tina. Thank you. We have the best quality brands available. We work with First Quality, so we do have Prevail. We also have gender-specific brands, which we've noticed are really big in the market. We have the Perfect for men. We have the Perfect for women. But not only that, we're able to give you better prices than a lot of local stores, and we also offer free delivery. No minimum order for a delivery, so if you need to order 1 pack or 3 cases of any sort of equipment, we will go out to your home and we will deliver to you for free of charge.
Would you deliver weekly or do you deliver monthly?
We deliver anytime you need it. If you need a weekly supply, if you need a monthly supply, we are also on call 24 hours a day. You can reach us at 702-724-1734. You will always have a live human being, whether you call at 9 in the morning or at 2 in the morning, somebody will answer your phone call. And we also service on the weekend. So we'll never tell you to wait till Monday if you need equipment right away or any sort of equipment on a Saturday, Sunday, Monday night, we'll be there to your door.
Excellent. And do you also help with transition from the hospital? A lot of people come home from the hospital and don't have all the supplies they need.
Yes, we do. That's a great question. We do help you transition. There's a lot of equipment that when you're coming out of the hospital, if you need a wheelchair, if you need grab bars, if you need a shower chair in your home, we will help you transition from the hospital so that when you do get home, your home is equipped with all the equipment that you need.
I'm really excited about this. There's a couple areas that I've been looking at in Las Vegas that seem to be the number 1, 2, and 3 reasons why people avoid getting the healthcare needs or the ancillary needs, and I always like to call them non-medical stress markers. And one of them is transportation. So, Gina, can you tell me about transportation services and that you can recommend with First Person Careline?
We can help our patients get set up with Logisticare, which is a private transportation that gives bus passes and private transportation to the disabled. We also help set them up with RTC. We go to health fairs and they offer free bus passes that we can help people with. Taxi cab services, if you meet the requirements, you can get half price off tickets for those. So there's different transportation companies out there. It's just a matter of getting the resources out to the patients.
So Logisticare, who's that specifically designed for?
Logisticare is designed for people on Medicaid. Based on 2 diagnoses, you can, again, get the free bus passes or the private transportation.
Okay, and these diagnoses, they can't be like a sprained ankle.
No. And it does have to be used for medical. It's not used for going to the store, or getting your hair done, or going to play bingo. But if you have to go to the doctors or lab work or any kind of x-rays or MRIs, it would be used for that.
Wonderful. And what about the taxi cab services that you were talking about? Do they have a special program maybe for the elderly people?
It is for the elderly.
Oh, it is. Okay.
If you qualify, you have to be 65 or older, and then you get the half price. So what you would normally pay for a taxi cab ride, it's 50% off.
What about services for people who are homebound and not ambulatory and really can't get out? It's a burden for them to even leave the house. Do you have services?
We have resources that are mobile, so they'll come to them so that they don't have to get out. It's sometimes difficult, getting someone who can't walk or who's bedridden. They can't get out to get these services done, so the services come to them, like mobile pharmacy. We have mobile labs, mobile x-ray, home visit doctors, home health that comes out. So you get a nurse to come out once, twice a week, physical therapist, nutritionist, MSW workers, mental health comes to your home. So there's a lot of resources out there that are mobile.
So if somebody needed services and they weren't ambulatory or couldn't move, all they'd have to do is call 702-551-3005 and you'd be able to assist them?
Correct.
Now, what if they didn't have insurance?
We have resources that do a sliding scale or a very low cost for first-person patients.
Okay, so they need to be enrolled with First Person Care Clinic or First Person Care Line or both? How does that work?
They could be enrolled with First Person Care Line if they are patients at First Person Care Clinic. It also gives them the resources at a very discounted rate.
Wonderful. And Mira, can you talk to me about the cash pay for people who are uninsured, how that works?
It's all depending on the level of care. So our rates vary depending on what they need. If there's a lot of clients too that may qualify for grants, depending on their age and their diagnosis, there's grants for them so that they can receive also transportation from us. And if they have a long-term care insurance, they can also get services through that.
It sounds like a lot of paperwork. Is there somebody that helps the patients with the paperwork and their families kind of to maneuver that maze?
Yes, we take care of all that. We help them apply and fill out all the paperwork.
How long does it usually take from somebody wanting services to be able to receive the services? What's that timeline?
If it's a cash paying recipient, then we can start immediately. With long-term care insurance, it does take a little bit of time depending on the insurance and what they need, their requirements. If it's through a grant, it depends also on the enrollment period. They have them about twice a year, so depending on when they're applying, it might take a little bit of time.
Give me an idea of how much time.
Usually it's every 6 months. So if it's January and June, so depending on when we start, they'd have to wait a few weeks.
Okay. And what about for the average patient that has Medicaid fee-for-service, that qualifies for PCA services? What's the turnaround on that, and what's involved with that?
With Medicaid recipients, they have to call a number and make sure that they are eligible for the services. They are assessed and they go out there, do the evaluation. They determine how many hours and what services they will need. It can take anywhere from 7 days up to 30 days. It just depends on if they've already had the services before and if they need them again, or if they're a brand new recipient starting the process.
Excellent. Donaldo, can you tell me about the insurance program and how it works with the medical equipment?
Yes. Through Medicaid, you can qualify for the free equipment to be paid for under Medicaid for our Medicaid recipients. And if, what we need a prescription from the doctor and a qualifying diagnosis from the doctor as well. And you can qualify to get your free briefs, your free diapers, the pull-ups, and the underpads. And not only do we service here in the Las Vegas area, but we also service residents in Pahrump, Laughlin, Mesquite, Henderson, North Las Vegas. So we are all over the
Boulder
valley
City?
here. And Boulder City as well. Yes, thank you. So we're all over the valley here, and we also service the outlying, the smaller towns and cities of the outlying Vegas area.
I didn't ask you, Myra. Do you also service outside the area of Las Vegas?
Yes, we do.
How far?
All over. We've have clients in Anthem, Aliante, Henderson, even Boulder City.
Mesquite or Pahrump?
Yes, we do. Mesquite, Pahrump.
Excellent. So people can get those services just by calling 702-551-3005 and letting Gina know that they require PCA or durable medical equipment, aka DME. And if they want those services, Gina can make sure that they get directed right to you with the necessary information.
Absolutely.
Excellent. Okay, I want to talk to you guys about veterans. We have a large veteran population here in Las Vegas, and the hospital is really overrun, and there's long wait times for the veterans to get the services they need. Gina, do you have any special programs that focus on the vets?
We work with different organizations. One of the biggest in town is Veterans Village. They help with placement, getting veterans off the street that are homeless, getting them into proper health care and getting them treatment. We work very close with them with first-person care clinics. We take the veterans in, even if they don't want to use their VA insurance. We do a sliding scale, or they can use their Medicare or Medicaid.
Are there PCA programs designed for veterans?
Yes, it's through the home and attendant program.
Time and attendance?
Yes.
Okay. Tell us about it.
They qualify through the home aid and attendant program through the VA. We do work with couple of places that can help us help them apply. It is a lot of paperwork, and they require a lot of information. Not only do we provide services to the veterans, but we can also provide services to the spouse of the veterans.
But you're there to hold the veteran's hand the whole way and make sure that the paperwork gets filled out?
Yes, definitely.
Excellent. And Donaldo, do you have programs and services for vets? Not at this time?
Not at this moment. Right now, we can only service Medicaid recipients and also private pay clients. We are working on getting in touch with the Veterans Association to become a provider for them. But at the moment, unfortunately not.
It's just as lengthy, isn't it?
Yes, it is just as lengthy.
Love government paperwork.
Yes.
But we're working on it.
We are absolutely working on it, yes.
Okay, wonderful. So we've been talking a lot about seniors, and we've been talking a lot about services that we provide to our elderly population. I'm wondering here, are these services transferable to people with children of need or younger families?
Yes, they are. A lot of the elderly have power of attorneys given to their loved ones and family members, which they can step in, and we work with them getting their loved ones the care that they need, making sure that there's eyes on them, that somebody, we can work with Meals on Wheels, 3 Square, the PCA companies, home health, just to ensure that continuity of care continues for their loved ones.
I love the idea that if a family member, a mom and dad come out here and retire and the kids are back east, that we have eyes on them and we can actually be that link for the kids to make sure that their parents aren't alone and that their parents are getting the services they need.
We get a lot of calls from out of state with their parents being snowbirds or retired, moving to Las Vegas, and they have no connection here. When they first get here, they may not have a phone, but by putting our eyes on them and getting them the resources they need, the family members call us, or we can contact them on a weekly, monthly, quarterly basis and give them updates as to the status of their loved ones, ensure that, yes, they're taking their medications, they're going to the doctors. We help schedule appointments for the elderly and the disabled to ensure that they do go to the doctor and get their medications refilled. For those that may forget or don't have time or don't have the money and transportation, we help out that way.
For the PCA services, because it's a Medicaid-funded program primarily, I mean, you can private fund, Do you find that families that have special needs children call on PCA services, or families that have maybe young adults in their families that are in need also use the PCA services?
Yes, we work with a lot of disabled, mentally and physical. We work with the parents that are mentally disabled or physical themselves that can't take care of them anymore. We help them with taking care of their kids.
Excellent. I like hearing all those wonderful things. And Donaldo, what do you've got?
And also, we also service children over 4 years of age or older. Also, we can provide them with the incontinence supplies and equipment that is needed. For those who are mentally disabled or physically disabled, you know, a lot of people think that briefs and pull-ups are just something for senior citizens, but there are a lot of special needs children that we service. So once again, any special needs child that's over 4 years or older, we can service them and provide them with the equipment and supplies as well.
So I just want to recap real quick. I look at First Person Caroline as the hub to all these resources in the community. And they can be skilled nursing or clinics, transitional care, home care, medication management, palliative care, primary care, mobile doctors, mobile imaging, mobile labs, and medical equipment, durable medical equipment. To me, I feel like there are a lot of resources in this community, but because we're siloed, that this is kind of a first example of how we're all pulling together and working as a network. I love the idea of having a network in the community where people can call one number and get all the resources that they could possibly need, not just specialized doctors, but everything down to transitional care services and PCA services and home health services and equipment services, all at one number. And that number is 702-551-3005. My last thought of the day is I would love for each of you to give me an example of how you have changed somebody's life through the services you offer.
I had a patient that was discharged from the hospital, no insurance, was diagnosed with cancer, came into our clinic, and we helped her get insurance so that she could get the surgeries and go to oncology and get everything that she needed. Saved her life. She's doing well.
Do you know how old this person was?
I would say between 38 and 45.
So not very old at all.
No. Had small children that depended on her, single. So she was the sole provider. Hasn't been in Vegas too long, so didn't know where to turn, what she was going to do. Was, very distraught, and we helped her through that process.
And that's the reason you get to wake up in the morning, right?
Yes.
Love it. And for you, Myra?
I had a case where a daughter called. She needed help with her father. He's diagnosed with Alzheimer's, and we went out there. We provided a caregiver. He's doing great, and she has a lot more time for herself, peace of mind, and she's very happy.
And the daughter probably speaks continually with the caregiver, stays in contact?
Yes. Not only do they speak with the caregiver directly, but we also call them. We do weekly call-throughs and make sure that everything continues to go well.
And Donaldo?
Yeah, I'll start by saying that we offer free in-home consultations where we go out and we give out, we can go over samples and we can go over different kinds of products instead of just giving you a generic or any sort of brief or pull-up. But one story that really kind of touched my heart was I went out to do a home visit with a client, and she was the girlfriend of the patient, and they had been spending money out of pocket on buying the supplies, and it really adds up, especially if you're on Medicaid. You don't have the funds available to be spending a lot of money on a monthly basis. So I went out there with our samples, and I gave her samples of different briefs and different pull-up options and different underpads that are available to them, and she literally broke down and started crying over, once I told her that she, her boyfriend can qualify under Medicaid to receive these items for free. And the samples and the products that we were going to provide for them were much better than the ones that they were buying. So she literally, once I told her that, we gave her the samples, and I called her back a couple of days and told her that her boyfriend was eligible and qualified, and we not only do we do free delivery, but we'll go out there every month and make sure that you have the supplies you need. She told me she never thought that she would be crying or be so happy about pull-ups or a diaper.
But the quality of life you gave
Yes.
her, you gave her probably those few pennies back that
Yeah.
she needed every month just to change
Yes.
the quality of
not,
their life.
Not just the quality of life, but also the peace of mind.
Well, you guys, you did pretty good today, and this is my first show, so I'm kind of excited about it. So this is Tina Drago, AM 720 KDWN, Healthy Las Vegas, brought to you by First Person Care Clinics, Downtown's Health and Wellness Clinic.